Good morning and welcome to Senator Mike Hilgers, legislative candidate from District 21. Thank you, Senator, for joining us for our virtual legislative candidate meetings. My name is Gina Ragland with AARP Nebraska, and joining me today is Susan DeCamp, Bob Lassen, and Danny DeLong, all AARP lead advocacy volunteers. Our AARP State President, Dave Holmquist, is also joining us, as well as Emily Wick from our state office. Senator Hilgers, again, we appreciate your taking the time to meet and discuss issues of importance to the 50-plus voter and their families in Nebraska. And as a reminder, this meeting is being recorded and will be shared with AARP members across your district prior to the election. So, Senator, if you want to start us off by giving us a little background about yourself and your campaign. Again, we're looking for 5 minutes or less. That would be great. And once we've completed your opening, we'll move into the questions. So again, thank you for joining us, Senator, and the floor is yours.
Thank you very much, and I will stay under that 5 minutes. Thank you all for making some time for me today, and I appreciate you providing this format to be able to communicate with you, but also, just as importantly, the members of your organization who are in my district or around the state. I think these are really critical issues that you have raised, and I appreciate your citizen advocacy on multiple different fronts. I think it's very important, and I'm grateful for the opportunity to have a conversation. I'll tell you a little bit about me and then a little bit about my political philosophy and why I think that's important going into next year and why I'm running for re-election. So I'm born and raised in Nebraska. I currently live in Northwest Lincoln. I have 4 little kids, 9, 6, 4, and 2 as of this recording. I started my own law practice 9 years ago in the basement of my home in the Highlands over on Keating Circle near Friedstrom, and over the last 9 years have built it to an organization now that has almost 40 lawyers around the country. It was named 3 times named company on the Inc. 5000 fastest growing companies in the United States list. And so we're very proud of the work that we have done, trying to think about the business of law differently, but we've been able to recruit families here to Lincoln who aren't from here, really sell the quality of life that Lincoln and Nebraska have to offer. I ran for the legislature, and I originally ran for the legislature in part because I'm a doer. I try to be a pragmatic problem solver, and I'm deeply committed to the community. I'm raising my family here. I ran and won 4 years ago. I currently serve on the Government Affairs Committee, the Telecommunications Committee, as well as I'm chair of the Executive Board, which is the committee that runs a lot of the internal functions at the legislature. And my political philosophy during the last 4 years really has been about trying to find what I describe as win-win-wins. I think a lot of our political environment today is a matter of trench warfare, fighting over narrow slices of partisan turf. And I think that is draining, and it causes a lot of discord and cynicism. And what I've tried to find are places where we can find wins for everyone. I don't think life, I don't think business, I don't think family time, and I certainly don't think politics is zero sum. So I'll give you a couple of examples where we found win-win-wins, and then I'll tell you why I'm running for re-election, and then I'll stop in under 5 minutes.
You're fine.
A couple of examples where we found win-win-wins. One is LB 271, which is a bill I brought my first year. So typically you think of it related to transportation infrastructure spending. Typically when we think of spending on any governmental program, we think this is a zero-sum thinking. If I spend more or money on this program, that means I've got less over here. And conversely, if I spend less over here, if I spend less over here, then that means I'm losing something else over here. And what 271 did is sort of rejected that paradigm and said, we identified red tape and actually some layers of bureaucracy in the system that were unnecessary. And on a bipartisan basis, without any opposition, we removed that red tape. And what we projected would save $19 million a year in highway construction. And it would also speed up major highway projects by a year or more. And there were a number of other states who had used this same process with a lot of great success. So that's one example of win-win-win. Another example, which might be more directly related to your members or those who care deeply about access to healthcare, is an expansion of the concept of direct primary care. Most people struggle getting access to primary care doctors, or they have access, but there's copays, there's deductibles, it's expensive. Utilization isn't as high as I think many of us would like. Direct primary care is essentially a concept where you can have a recurring monthly relationship with your primary care doctor, and the mechanism, or I should say the model for that, is that people can go unlimited visits, no copay, no deductibles, tend to have a lot cheaper diagnostic tests, and all the data show that you get higher quality long term, you have better access, lower cost, better satisfaction for the providers because they don't have to deal with insurance companies. Again, win, win, win. That's probably a fourth win on that one. And then the last example would be the South Beltway, which is not in North Lincoln, but impacts our entire community. That's a 9-year project, 8 to 9 year project, $300 million. My bill, LB 616 last year, helped accelerate that from 9 or 8 to 3 and projected to save $20 to $30 million. We're going to get the economic development faster. We're going to get the safety benefits faster, tax revenue faster. We're going to save money. So those are winning for the community. All those passed without any opposition and with bipartisan support, or at least wide support. I'm running for re-election to build on that. There's an opportunity in the next 2 years in particular, building off of all the institutional knowledge from meeting stakeholders, learning the issues, learning the process, sort of at the maximum level of knowing the body and knowing the individuals with term limits people cycle out. So the next 2 years are an incredibly important time to be able to make a huge difference. So that's why I'm running for re-election, and I'll stop there because I think it's 5 minutes.
Okay, thank you, Senator. We'll just now again move into the questions. We provided you with a set of 3 questions pertaining to the 50+ voter in Nebraska. Again, allotting 5 minutes for each of those. So our first question will come from our state president, Dave Holmquist, and it addresses helping people stay in their homes and communities. So go ahead, Dave.
Good morning, Senator. Thank you for joining us, and thank you for your service. This is about livable communities, really. So a livable community is one that is safe and secure, has housing that is affordable, in other words, no more than 30% of income is spent on housing, has transportation options that allow individuals to travel by multiple means, and has supportive community features and services for people of all ages, and then allows people to remain in their communities as they age. What steps will you take to ensure that all Nebraskans have access to livable communities?
That's a great question, Dave, and thank you for asking that. So I was taking notes here. So for those of you who watch this recording later, that's what I was doing. So I want to make sure I address each one of your points. So I think there's there's multiple layers to your question. There's the affordability side, there's the services side, there's the cost side, there's the support side. So let me walk through and unpack a few of those. To some degree, Dave, I think the answer to your question relates to the vibrancy of a particular community. So some services, whether they're transportation services, living at home services, et cetera, might be available in cities like Lincoln or Omaha, or at least be more prevalent than they might be in other communities. And so I'm gonna flag that as an issue, and I'm gonna come back to that in a second. But I think a couple things to focus on is the cost side. So you talk about affordable housing has both the cost equation and the ability to pay for it equation. So the cost equation, the legislature impacts a few things. One is it impacts to some degree, even though this is largely driven by local spending, but the legislature has a role in what your property tax level is. It also plays a role in how affordable that housing is. You know, the legislature, especially before my time, but even a little bit recently, can create mandates for new housing construction that can significantly increase the cost of housing. The legislature plays a role in to what degree your property tax, your ability to pay, and if you're on fixed income, your ability to stay in your home is a function of the cost of that home as well as your resources to pay for those. Another aspect of the support side would be, I think, 2 things. One would be your own income and ability to support your living expenses at your home. 2 years ago, I was a co-sponsor of a bill to eliminate the reduce the income tax on Social Security income. We also did separately, at least for a subset of retirees, on military retirement pensions. We did have a bill, again, one I was a co-sponsor of, to reduce by half the income tax on military retirement pensions. Doesn't apply to all your membership, but certainly some. So that's part of it, is making sure we're working to keep the affordable housing affordable and not adding additional burdens that aren't really justified by the safety. Certainly there are some additions that are absolutely justified by increases in safety or environmental protection. Secondly would be to make sure we've got some of those resources, and whatever dollars you are getting through Social Security or pensions, you're keeping more of those dollars. And I would say there's a broader point, and then I'm going to circle back to what I said I was going to circle back to, which is the idea of a greater growing Nebraska. I think a big hidden part of this is the ability to have family members close by. I am from Nebraska, as I mentioned. I grew up in Omaha. I went to school outside of the state. I went to college and law school outside of the state, and I practiced in Dallas for some time. In fact, all of my 5 siblings, so there's 5 of us, my 4 siblings and I, we all left to Texas to go to school. 4 of the 5 of us are coming back. And you will be able to find, now, right now my parents are living at home, and I think, I hope that is the case for a long time, but there will be a direct correlation between how long they will be able to stay at home and the fact that they have nuclear family members close by who can help. And so we have to look at the things that keep those family members home. One thing that does keep them home, by the way, is having grandparents nearby. But another thing is the ability to have strong job opportunities, economic opportunities, and finding Nebraska a great place where they can raise their family. I've proven by example that we have a lot to offer as a state. I have recruited a number of families, we're not from Nebraska, as I mentioned a minute ago, to Lincoln, and I'm very proud of that. We have a lot to offer, but there's things we can do from a job growth perspective and a tax burden perspective to make it easier for those families to come to Nebraska instead of go to Colorado or other places where maybe they can make more money. Your point about circling back to the first thing that I said, and there's so many, I don't know if there's follow-up here, and I'm happy to dive in. We have to have a one Nebraska perspective. I live in Lincoln. I want Lincoln to succeed. I want Omaha to succeed. I want Holdridge to succeed. And the more that they can succeed, the better off our community is. And so we have to have a strategy. And in the legislature, I think there's an opportunity over the next 2 years to develop and execute on a growth strategy for those communities to help recruit young people back or keep them there, to help take advantage of this digital environment and economy that we're in, to help build businesses and grow businesses, something that I have done in those communities, which will help support the kind of support services that I've described that might exist in Lincoln, the stay-at-home support services, but maybe don't exist in the same way in other places.
Thank you.
I'll stop there. I don't know how long I have for each answer. I try not to be too wordy. I do apologize, but there's just a lot to unpack.
Appreciate your thoughts, Senator. And one thing I don't know that it's a follow-up, but just also adding into the conversation, Homestead Exemption is a very important piece for our members. Again, we talk about aging in place and keeping people in their homes, and sometimes the Homestead Exemption might be one of the only pieces of the puzzle that does keep that in place. So hoping that you continue to be supportive of that initiative as well as we move forward, and again, having more Nebraskans aging, but again, that is a crucial piece of keeping people in their homes. So very much appreciate your thoughts on that. And if you wanted to follow up, certainly do so.
I did, and I'm sorry. I didn't. I'm very glad you said that. I'm very supportive of that. But I did want to say, because I didn't say it at the outset, I think keeping Nebraskans at home as long as humanly possible is one of the most important policy goals we possibly could have. From a quality of life perspective, from a family perspective, from an emotional perspective, I think it is absolutely critical. As a son for 2 aging parents, as a father who eventually will be aging at home, I hope, as long as I possibly can, I think it's a moral imperative to try to do that. And so I didn't convey that at the beginning of my answer, but it wasn't because it wasn't important. I just was diving directly into Dave's question. But it's absolutely critical in any year, any week, an additional week, month, year that we can give people beyond what would otherwise happen, I think is incredibly priceless and very valuable.
Absolutely. I appreciate your thoughts on that. Thank you so much. Our second question now will come from Susan DeCamp, and we're going to talk about health, caregiving, and home and community-based care, which I think was a nice segue into this question. So go ahead, Susan.
Good morning, Senator. It's nice to have you with us. I know that you've answered a big portion of my question already, but I'm going to go ahead with it. So caregivers help older persons live independently at home by providing assistance with activities like bathing, dressing, and performing medical and nursing tasks, such as administering medication and wound care. But caregivers often provide these services with little or no training and little or no pay. So with that in mind, I have a 2-part question for you. First, will you support helping caregivers with paid leave, respite services, telehealth, and access to education and training? And secondly, how would you protect or expand paid services and supports, as well as financial security that allows more seniors to live independently in their homes and communities? And I know you've answered that financial security piece, a little bit already, talking about the bill that you co-sponsored for reducing Social Security taxes. and Homestead Exemption. But if there's anything else you'd like to expand on.
Yeah, no, thank you. And I probably would divide my answer in part based on private pay caregivers versus any Medicare provided or Medicaid provided caregivers through the governmental. So on the maybe it's not easier to answer that, but it's one that we have a little bit more direct control on because as you all know, the legislature can help set the provider pools, the rates by which individuals can pay or get paid, the providers get paid. And I think you hit on a very core key point that I've seen anecdotally, and we all, I think, know to be true, which is this is an incredibly difficult job. It's incredibly important, and you need to have people who are trained and committed to doing it. Well, in general, in my life, you know, there certainly are missionaries in the world who do amazing work or are committed and trained to do who don't get paid, but we can't rely on a missionary business model for providing these services, these particular services to people who are aging in place. And I already talked about how critical it is to try to do that. So really it comes down to a training in dollars perspective. And on the governmental side, I think this is an opportunity for an absolute win-win-win, like I've talked about before, some of this green space opportunity to not have zero sum. This idea of, well, if we pay $1 more or $1 less, that means someone necessarily is gonna lose $1 somewhere else. And I'll draw an analogous, from an analogous point in time when we had my very first year, and I'll circle back to this, we had some really significant budget deficits. And we had to there were some budget cuts to the provider pools. It wasn't for this area, but it was for some disabilities of benefits and the like. And one of the concerns that many of us had, including myself, was, well, wait a second, if you're gonna cut the pool, that means the provider's gonna get paid less. And actually, it turned out that was not the case because there was opportunities from a business-oriented perspective to find dollars within the greater pool and keep the rates constant. So the providers they didn't have to absorb any cuts, which most of them can't absorb, and actually should get paid more. And so my perspective is we have got to find places to do the same type of work, not to avoid a cut, but to raise those rates so that we can get good quality people. And so Senator Arch, who's a really good friend of mine, who's the vice chair on the Health and Human Services Committee, I hope he will be the chair of the Health and Human Services Committee next year. It remains to be seen. I don't know what the world will look like come January. He's a very pragmatic leader, business-oriented, compassionate, empathetic leader. It's an area that he and I are going to have discussions on, but I think that's the focus. I think that is where we can make a great deal of significant impact, find ways to pay more, but doing it in a way that maybe find some inefficiencies in the system, which we've already shown we can do. So let's look at it there. On the private side, I've seen firsthand how difficult it can be to find those individuals. I've got a friend who, you know, they're paying $20 an hour to try to find someone who can do just some part-time caregiving, not trained, just someone who, so they're not doing some of the things that you mentioned, Susan?
Yes.
Or Suzanne. Okay, Susan. Some of the things you mentioned, they're not trained in that, and they can't get anyone for more 2-3 days, which I think goes directly to your point about, you know, it requires financial resources and paying people, not just some of the things, you know, paid leave and some of the things you mentioned. If those are ultimately the things that are on the margins that keep people from doing this versus not, then we ought to look at that and support that. My hunch is it's even more than that, that we've actually got to pay a lot more, and we've got to, on the private side, it's you know, it's going to require more dollars. You know, the people who are wealthy who can write those checks, they're always going to get taken care of. It's how do we find more efficient ways of using the current services, and that's sort of a broader question of, if it's not a governmental reimbursement issue, then it's a broader question of, do we have the talent in town? Do we need to recruit more people? Is there a way that we can, from a regulatory perspective, pull out costs that are impacting these providers so they can put more money? And to be candid, I don't have all the answers in that particular area, but that's where my mind would go on the private side.
Great, thank you very much.
Senator, great answers, and I think that's definitely more discussion down the road. I appreciate your openness to that and the fact of that. I appreciate the win-win-win. I appreciate that you're looking at it because it is something that's very important to our membership. So thank you for your thoughts on that. Our last question now will come from Bob Lassen, and it switches us now into nursing facility quality. So go ahead, Bob.
Yes, we're going to shift from the at-home to those people that need more services and they can receive at home. So an estimated 6,600 Nebraskans reside in one of Nebraska's 211 nursing homes. By 2040, the University of Nebraska Omaha projects that number will more than double to almost 14,000. Due to a variety of factors over the past few years, Nebraska has seen an increase in nursing facilities having to close and residents to relocate elsewhere. The two primary factors that are listed are lack of staff. They can't, the facilities can't find adequate staff. And the other one is the reimbursement, particularly the Medicaid. When that's low, then the private portion that's paying for their care is increased. So I guess my question is, what can we do to encourage individuals to go into this type of nursing, to provide that staff? And the other ones is to what can we do to assure that we have proper reimbursements to take the burden off the private pay portion of the facility?
Well, it's a great question. I think those two reasons are the key reasons, and they're intertwined, because the lack of staff also comes from the the other financial opportunities that might be more that might pay better. It's a hard word for me to say. That will pay better in other fields. You know, I think one area that's worth exploring, and I realize I've talked so much, we're probably out of time. I think one area that's worth exploring is talking about this more as in terms of a true profession, whether it's within nursing or otherwise. I think there's a lot of social value that when people feel like they're going into a profession, and there creates some stickiness. If you think about nurses or doctors, people who, I mean, pay certainly is part of it. Don't get me wrong. Of course, it's a significant part of it. But when people feel like they are part of something that's bigger than themselves, that it's a profession that they're engaging in, and it's a lifelong career, I think that's something we ought to explore and elevating potentially, because I think it might create less of the revolving door and more of the stickiness for these professions. Part of the, you know, we had a hearing in the executive board on this precise issue because there was an interim study on this. A lot of the issues that we were seeing in a lot of these facilities, and the public counsel's office is sort of within the purview of the legislative council, which is under the executive board jurisdiction, the committee that I had. So we heard a lot about this. A lot of the issues here, and they were most acute, not entirely, but most acute in areas that had less population. So even if you could pay more, the question is whether or not you could get high quality people. So to some degree, is that a longer term answer? Kind of what I was speaking about with Dave in terms of trying to build out these greater Nebraska communities and sparking more economic development and more young people coming back. I think that's part of it. I think part of it is the more we can do on the keeping people at home and create less of a need and maybe flatten that growth rate on people going into nursing homes. I think that's part of it as well. I think if we can solve the payment issue and make this more financially lucrative career, and combining that with this idea of service to a broader profession, I think those are all pieces to this particular puzzle. I don't think it's one you can wave a policy magic wand at, but it's one that we need to approach with the sort of moral urgency that I described a minute ago, because when those facilities are primarily being paid for by taxpayer dollars, we all should feel, as taxpayers, as elected officials, as concerned citizens, a moral obligation and responsibility to make sure that that is as good of a facility as we possibly can make it. So I probably could go on a lot longer than that. I realize I've gone beyond time, so I do apologize, but it's a great question.
Thank you.
And I think that's, again, more follow-up to come, I think, Senator, but again, investing in our young children, the intergenerational, making this as a career that is attractive, and not just going into nursing, but finding a segue that routes people, you know, and training people in their communities, and maybe not so much in our metro areas, but our rural communities. I think that's another important piece. So appreciate your thoughts and comments on that. And we are getting to the end of our time, but I want to throw it back to you and offer you any moments of closing thoughts or comments that you might have, or messages you want to send to your constituents in the final minutes. So the floor is back to you.
Well, I appreciate that very much. Thank you again for the time and opportunity. You know, I would say that we live in a world right now that feels like it's getting pulled apart by political forces. I think there's a increase in the rise of cynicism and anxiety and, frankly, tension and hostility between fellow Nebraskans and fellow Americans. And I think one of the things that I have found can pull people together is when we all are focused towards broad-based positive policy solutions, and we're focused on goals that we all can rally behind. And when it's not just based on words or rhetoric. And that's why I've run, and that's why I'm running, because we actually have a track record of doing that. We've done it for the last 4 years. There's an opportunity to do it going forward. And I would just invite constituents who watch this, those around Nebraska, to email, to write, to get engaged, to be positive, and be part of a broader solution. In the Nebraska unicameral, which is nonpartisan, it truly is a special place where differences can be made. And that is exactly what we're trying to do. But we need people of goodwill and civic responsibility to be engaged, be educated, and be responsible, and be a part of the process. So I know this group is one of those groups, but with highly engaged, civic-minded, civic-oriented people. I'm very grateful for all that you've contributed in Nebraska and our society. And I think the best way for us to honor the investments that you have made in making Nebraska great and making it such a great place to be is to continue to maintain it and make it even better, and support our more senior members of our society in this stage of their lives.
Thank you.
Appreciate your thoughts, Senator. Again, thank you for taking the time to visit with us. We wish you the best with your campaign. We look forward to working in the future. And again, thank you for meeting with AARP Nebraska today.
Likewise. Thanks so much for the opportunity. Have a wonderful day.
Thank you.
Bye-bye.
Bye-bye.